Welcome to the Centers for Medicare and Medicaid Services module, the Section J, Health Conditions, Pain. This module will introduce learners to HIS Section J, Health Conditions, Pain, which includes items J0900, Pain Screening, J0905, Pain Active Problem, and J0910, Comprehensive Pain Assessment. This is the fourth of 8 modules in a larger series, HIS Coding Guidance. The series overall is intended for users who are familiar with HIS coding and submission guidelines. For newer users, we recommend starting with the HIS manual and older trainings first. These modules will not cover all items in all sections. Learners may choose to listen to the entire series or may choose to listen to 1 or 2 modules that are of most interest to them, meaning the modules in this series can be watched independently or as a group. Included here on Slide 2 is a list of acronyms that will be used in this presentation, listed in alphabetical order. After completing this module, learners will be able to identify the items that compose Section J, Pain, and the quality measures corresponding to the items in this section. Learners will also pick up some tips for completing certain items in Section J. Specific tips, including learning to identify Warning Edit 3077 regarding J0905 Pain Active Problem and Section N opioid items N0500 and N0510, why it appears, and how to resolve if necessary, as well as how to complete a pain assessment on a nonverbal or non-responsive patient. The items in this section correspond to quality measures NQF 1634, Pain Screening, NQF 1637, Pain Assessment, and NQF 3235, Hospice and Palliative Care Composite Process Measure, Comprehensive Assessment at Admission. Items in this section capture 2 processes of care that should be delivered around the time of admission to hospice. The first is the pain screening, including the result of the screening and, if the patient was in pain, pain severity and type of screening tool used. The second is if the patient had pain, whether a comprehensive pain assessment was conducted. Let's talk now about J0900 pain screening. This item has 4 parts. J0900A, which asks if the patient was screened for pain. J0900B, the date of the first screening for pain. J0900C, the result of the screening, in other words, the severity of the patient's pain. And J0900D, the type of screening tool used. This item should report on the first documented screening for pain. If multiple pain screenings appear in the patient's clinical record at the time of HIS record completion, complete J0900 based on the first pain screening. There are some special circumstances you may run up against when completing J0900. If the patient reports a range in their pain severity, record the highest severity rated. For example, if the clinical record indicated the patient said their pain was moderate to severe, record the higher rating in J0900C. If the patient gives a historical report on their pain, record the pain severity at the time of the visit during which the screening was performed. For example, if the patient said, "Last night my pain was moderate, but right now during this screening visit, it's mild," you should report mild for J0900C. J0900 corresponds to NQF 1634 pain screening. NQF 1634 is the percentage of patient stays during which the patient was screened for pain during the initial nursing assessment. To meet the numerator criteria for NQF 1634, you must conduct the pain screening within 2 days of the admission date, and if the patient had pain, you must have rated their pain severity using a standardized tool. Responding yes to J0900A is not sufficient to receive credit for the pain screening QM NQF 1634. You must meet the other criteria within 2 days and rating severity using a standardized tool to receive credit for the measure. The next item in Section J, Pain, is J0905. J0905 reports whether pain is an active problem for the patient. Let's talk about a few things to consider when responding to this item. J0905 lets you consider facts beyond severity at the time of the screening clinical encounter, such as historical report of pain or recent symptoms. So, if the patient said, "Well, right now I don't have any pain, but last night my pain in my left knee was just unbearable," you can take last night's pain into consideration when completing J0905. In this scenario, you'd respond yes to J0905 because, although the patient doesn't have pain right now, pain is an active problem for them, as indicated by their recent history of pain. You'll notice that this instruction is different than the instruction we just went over for J0900, where you are to consider only the pain the patient reports at the time of the visit. In this sense, think of J0900 as only the patient's pain at the time of visit, and J0905 as a broader item that includes the patient's recent pain, extending back beyond the time of the current visit. There are a few things that are generally going to be markers that pain is an active problem for the patient. One that we've already talked about is recent historical report of pain. Another obvious one is if the patient has current pain. A third clue would be the patient's current medications. Generally, clinical documentation that the patient is currently taking pain medication is evidence that pain is an active problem. However, comfort kits or pre-printed admission orders alone is insufficient evidence to determine pain is an active problem. Some of you may have experienced a warning when you reported that pain was not an active problem, but the patient was taking scheduled and/or PRN opioids to treat a symptom other than pain. In the next slide, we will clarify Warning Edit 3077. We get a lot of questions on the help desk about Warning Edit 3077, and you may have seen it appear in Keys ASAP or CASPER reports when you attempt to submit an HIS record. Warning Edit 3077 occurs when hospice responds yes to item N0500 and/or N0510, indicating that a PRN or scheduled opioid was initiated. But the hospice responds no to J0905 pain active problem. This warning edit is intended to help you review whether your answer to J0905 was correct. If the patient is on an opioid for pain, you should respond yes to J0905. However, if the patient was on an opioid for another symptom, like shortness of breath, and there's no further evidence pain is an active problem, you can ignore the warning edit. Remember, you do not want to change your response to J0905 simply to resolve the warning edit. The final item in Section J, Pain, is J0910. J0910 reports if clinical documentation supports that the patient received a comprehensive pain assessment, and if so, the date and pain characteristics included in the first documented comprehensive pain assessment. Pain characteristics include location, severity, character, duration, frequency, what relieves or worsens pain, and its effect on quality of life. A comprehensive pain assessment should include multiple aspects of pain beyond presence and severity, as this lends itself to quality pain management and treatment. Hospice patients are often nonverbal or non-responsive. It is possible to include elements of the pain characteristics shown on Slide 10 for nonverbal patients. As noted in the HIS manual, there are two primary ways to gather pain assessment information for a nonverbal patient. The first through nonverbal pain cues, the other is through caregiver report. For J0910, it is acceptable to use both if they were documented in the clinical record. Nonverbal indicators of pain include, but are not limited to, crying, whining, groaning, grimacing, clenching jaw, guarding, rubbing, bracing, and clutching. For example, if the clinical record indicates patient was clutching and rubbing right elbow, this could be evidence of location of pain. Similarly, if clinical documentation notes patient's face relaxes and ceases moaning when turned on their right side, this could be evidence of what makes pain better. It is possible to use nonverbal indicators of pain for all pain assessment elements except character of pain. For J0910, you can also use caregiver report, and coding can be based on documentation that supports the clinician attempted to gather information from a patient or caregiver. For example, the clinician asks the caregiver of a nonverbal, non-responsive patient about location of pain. The caregiver answers, "I don't know, I'm not sure." This is considered an attempt to gather information, so location should be checked in J0910C as the clinician attempted to gather information. The Pain Assessment NQF 1637 quality measure reports the percentage of hospice patients who screened positive for pain, who also received a comprehensive pain assessment within 1 day of the pain screening. Before we talk about that, let's talk about who NQF 1637 applies to, as it doesn't apply to all patients. NQF 1637 is a conditional measure, meaning it only applies to a subset of patients. Specifically, NQF 1637 only applies to patients who screened positive for pain or those who reported having any pain other than none in J0900C. What does this mean? This means that if a patient reported no pain in J0900C, they are not in the denominator for the pain assessment measure. In terms of the impact on your pain assessment QM score, think of these patients as neutral. Whether you actually completed a pain assessment for them doesn't matter, as completing the pain assessment for these patients, or not, doesn't count for or against you in the pain assessment QM calculation. In other words, for excluded patients, you could go ahead and do a full pain assessment, and this may be good clinical practice, but in terms of the QM calculation, the assessment wouldn't count for you in the QM numerator. Conversely, the fact that you didn't do an assessment doesn't count against you, and the reason why is because the patient is excluded from the denominator. So for those patients that are included in the measure denominator, how do you also meet the numerator criteria for NQF 1637? A comprehensive pain assessment must be completed within 1 day of the positive pain screening, and the assessment must include at least 5 of the following characteristics: location, severity, character, duration, frequency, what relieves or worsens the pain, and the effect on function or quality of life. A comprehensive pain assessment that does not occur within 1 day of the pain screening or does not include at least 5 characteristics does not count toward the numerator, which results in a hospice not getting credit for the measure. In other words, simply completing a pain assessment is insufficient to get you credit for the measure. The assessment must occur within the specified time window and must meet the definition above, include 5 out of 7 characteristics, for you to receive credit for the measure. This concludes the items in Section J, Pain. While the series overall is intended for users who are familiar with HIS coding and submission guidelines, information regarding the Hospice Quality Reporting Program can be found by clicking the hyperlink on this resource slide. This resource slide also contains hyperlinks to specifics on the HIS hospice quality measures, the QM User's Manual, and the HIS Manual V2 with the change table. The Hospice Quality Help Desk is available to assist with general questions about the Hospice Quality Reporting Program. This concludes the module Section J, Health Conditions, Pain. This module focused on coding guidance for the items in Section J, Pain, as well as the specifications for the associated quality measures. This is the 4th of 8 modules in the series, Hospice Item Set Coding. The other modules in this training series are listed here, and we encourage you to view these training modules as well to understand more about HIS coding and learn how it may help you and your hospice. Thank you for viewing this presentation. The information presented was correct as of the date it was recorded. This presentation is not a legal document. Official Medicare program legal guidance is contained in the relevant statutes, regulations, and rulings.